So, from a physiotherapy point of view, so what kind of common limitations, um, functional or physical, do you actually see in patients with the end stage kind of lung disease that requires a transplant? So, what kind of symptoms and other things do you look for?
Yeah, so obviously the one that springs to mind most commonly for people is that shortness of breath, or dyspnea, as we like to call it, sort of within the medical field. But that's the first and easiest one that people think of, and absolutely, the large majority of patients that we see for transplant do have significant shortness of breath that affects their ability to do everyday life activities. But I suppose the other stuff we do commonly see is fatigue is incredibly common as well. Just that tiredness and ability to get up and go is a common feature. We also commonly see things like muscle wasting or sarcopenia, so the loss of muscle bulk. Yeah, our muscles really are use it or lose it, and it's hard
Mm.
when you're short of breath to get up and move around, and so those muscles also waste, which ironically contributes to shortness of breath in itself, and also someone's fatigue. And some of this stuff all combines to look at overall general frailty that we do certainly see with people. Probably some of the other stuff we do see, depending on people's conditions. So, for example, is lots of coughing, which can impact their ability to move around because
Mm.
often as they breathe a bit heavier when they're moving, that triggers off coughing fits, particularly people with interstitial lung disease. And some of the people that we see with pulmonary hypertension, for example, it's not so much shortness of breath that limits them, it's actually dizziness or chest pains, or feeling like they're going to pass out that we actually see. So there's not a one size fits all. It is different for each person. And it's really going through and working through the individual about what's limiting them, and then how we can sort of best address that.